Hello and welcome. I'm Alan Jansson from Acupuncture-goldcoast.com and Acupuncture-brisbane.com. Thank you for taking the time to watch this short video. This year I've seen my normal yearly quota of patients in the first 2 months that I would normally see in 12 months suffering from Ross River fever. From what my patients have said to me and what's been said to them in the outpatients when they've gone to the hospitals to get some sort of resolution or diagnosis for their terrible symptoms, it is quite apparent that there is an epidemic of Ross River fever. There's an outbreak in southeast Queensland. I think this has obviously got a lot to do with the extraordinary number of mosquitoes as a result of the wet season that we've had. It's also got to do with actually a general warming, I think, of the climate. It's almost like the mosquitoes carrying the virus, the Barmah Forest virus and the Ross River fever virus, have actually moved south a little bit, and there's more of them, if you like. Certainly from my clinical experiences, there's more mosquitoes around carrying the virus. And I draw that conclusion purely and solely from the number of people that have sought my assistance as a result of coming down with Ross River fever. The terrible symptoms, the headaches, the bone aches, the joint aches, and the absolute overwhelming lethargy in combination with the inability to actually deeply sleep and have restful sleep. It's a wicked combination. I have one particular lady coming to see me at the moment who, in combination with suffering from Ross River fever, she also has a chronic ulcerative colitis and gastritis. So her digestive tract is in a constantly irritated state, and her doctor has prescribed her anti-inflammatory medication and painkillers to control the pain and the inflammation that was a result from the Ross River fever, and which in some degrees it's like robbing Peter to pay Paul. Whilst there may have been some amelioration of the pain and some reduction in the degree of the fevers, the interaction of the medication with her already existing gastritis and ulcerative colitis has been quietly diabolical and has caused a whole separate set of symptomology. So it's a very, it's, in my experience, the acupuncture is incredibly positive in assisting people who are suffering from Ross River fever because of the lack of negative side effects. In almost every case, it's really the benefits only that pass on. It's quite a concern. I mean, I talked to people who they went away to northern New South Wales. It was 2 couples went away, and two of the individuals that went away, the 4 people came back with Ross River fever as a result of being bitten by mosquitoes, and 2 got lucky. So yeah, I would urge certainly caution, take the appropriate precautions with either wearing a repellent or lighting some particular candles around the area to keep the minimum number of mosquitoes around. And if you find yourself or your family or your children being assailed by mosquitoes in any particular area, it may be wise to move on to a location where there is less infestation. I guess the less number of times you get bitten by the mosquito, the less chance there is of contracting this really quite nasty virus, this Ross River fever. So this is just a little sort of heads up, if you like, my observation of what's going on here in the early part of 2015 and the increased incidence of Ross River fever. Certainly I found acupuncture to be incredibly effective in helping counteract some of the very nasty effects of that particular illness. This is Alan from Acupuncture-goldcoast.com and Acupuncture-brisbane.com. Thank you very much for taking the time.